Good afternoon, guys. I am Rebecca Gaskins, Becky, for those of y'all who I have not met yet. I am here as the new vice chair of GCTE. Unfortunately, Lynn was not able to join us today. Hopefully, Tracy will be able to hop on in a second. She was going to help me lead my first GCTE meeting. So, first,
I'm right here.
Thank you, Liz.
I'm right here.
Thank you. Okay.
It's going to be okay.
First, we'll go ahead and establish our quorum.
Scroll up so we can see the subcommittee chairs.
Actually, Suzanne's on. Okay, Suzanne.
Rayma. And Crystal. Do we have Rayma and Crystal online or here?
Rayma's on.
Okay.
Got it.
Okay. All right, we're good.
All right, perfect. All right, can we get an approval of our October 30th minutes? All right, do we have any new members with us today?
Oh, we technically have to vote.
Oh, sorry, just kidding.
It's okay. Look, I'm helping you already. See how good this works?
Perfect.
Any discussion on the minutes or any edits or anything since we have a first and second? And we'll just say anybody opposed to the minutes approval, signify now or forever hold your peace. All right, we can consider the minutes passed.
Got it. Thanks, Liz. All right, do we have any new members with us today?
I see Dr. Masood in the front row there. He's a new member. It's great to see you. Thank you.
This is Tracy. Can you hear me now?
Yes.
Hi, Tracy.
Welcome. Thank you.
For some reason, my computer is not connecting, so I phoned in.
I don't think we have any new members present here, Tracy. I'm not sure if anybody wants to chime in who's online, or if you want to put a message so we know to introduce, as we know there's lots of turnover in the centers. We're happy to give a formal welcome to your new members, so just call it out or put it in the chat so we can make sure we know who's new at your center.
Hi, yeah, I just wanted to introduce myself. So I started working with the pediatric group for Georgia. My name is Lisa Nichols. Can you hear me okay?
Yes.
Oh, sorry. Okay. Lisa Nichols, I am the trauma program manager at Wolfson Children's in Jacksonville, Florida. And as we get numerous patients and stuff from kind of the southeast and just the south regions and stuff of Georgia, I had asked as far as kind of joining this and making sure that, we're all, kind of giving the same information. And I really have a good idea as far as what y'all are working on in Georgia. So I appreciate the opportunity to be able to be involved in this. Thank you.
Lisa, and I know when I was on the last pediatric committee call, you were on too, and we really appreciate you, our partners across our borders there coming and joining in the effort with us and figuring out, what this looks like. And we certainly value your perspective. You offered a lot of really good points on the pediatric committee call, so thank you. Thanks for your participation. I think that's it.
All right. First, we have Elizabeth Head going to talk to us about a dementia initiative from DPH. Is Elizabeth here or online? All right. Next, we have a LifeLink update from Kim Cotterman and Chuck Massey.
Sorry, Kim no longer works with this. She's still at LifeLink, so don't worry about that. But they've assigned me all the trauma stuff, so we don't have her pretty face to look at. You'll just have to deal with me. So sorry about that. But thank you for the opportunity to be here today. And I was disappointed that Tracy's not here today, since she calls me her hospital husband. It's okay. I won't take it personal. So if you'll get to the next slide, we're just going to do a little 5-year summary for trauma and donation for the state of Georgia. So,
if you can speak a little closer, sorry, they're still having trouble hearing unless we're...
Yes, ma'am. So I know you can't see that sitting there, so I'll just kind of read the highlights to you. So for the last 5 years, in Georgia, we had nearly 4,000 trauma referrals total. 3,894 of those were organ referrals for potential donation. We had 2,110 on-site visits by LifeLink staff for those 3,894 potential organ donors. We requested from 1,054 families for donation and had 572 total organ donors in that 5-year time span. So 420 of those were brain dead patients, and 152 of those were donation after cardiac death. That number will continue to rise each year as brain death numbers have gone down, which is not a bad thing whatsoever. And donation after circulatory death or cardiac death is definitely on the rise. So now about 40% of our donors typically each year or DCD. In 2021, there were 679 organ referrals. 2022, 748. Each year we've had a increase, but then in 2024 we saw a decrease to 845, and in 2025, 756 referrals from trauma patients. So there's a direct correlation when you see that decrease. In 2021, we had 112 organ donors, 120 in 2022, and then 94 in 2024. And in 2025, we had 100. So we had 6 less referrals on potential organ donors, but 6 more donors. So on that next slide, you can see that just again, thank you, that, and I'm sorry, I should have said this a while ago, blue is the current calendar year and the green is the previous year. In 2025, we had a total of 100 organ donors, 415 organs were transplanted from those trauma patients. Organs transplanted per donor, 4.15 versus 3.30 from non-trauma patients. That's about 1 to 2 organs more per donor if it's a trauma patient, typically. Next slide just talks a little bit about April. You guys know that April is Donate Life Month every year. For accountants, I think they probably hate January, February because they're busy. I don't like April because we're busy, but it's a good month. We get a lot of good publicity. If you have an opportunity for LifeLink to do something at your facility you work at or at your church or social civic, anywhere we can be to talk about donation and try to get people to make decisions about being a donor, whether that answer is yes or no, we like for them to do it in a comfortable setting versus at a bedside during a crisis. That's certainly not a good time. So this year's theme, they use trees as a symbol of life. This is the national effort through HRSA. Just like the trees grow and support each other in a forest, donation connects people, donors, recipients, their families. Like a tree that grows and stands for generations, a donor's gift leaves a lasting legacy of hope and life. Some of you guys know my story. I've been at LifeLink 32 years, which is a long time. Especially now, when I first started, a lot of the new residents were my age, a little bit younger. Now I could be their dad, great uncle. But it's been a great journey. I got into this job because I was a pharmaceutical rep and had a family member who needed a heart transplant after a pregnancy-induced cardiomyopathy, and I just thought she'd go get it. I just thought, she's on the national list, or I thought Emory had a list. I didn't know it was a national list, and luckily she did get it, and we just celebrated 37 years with her heart transplant last month. So long journey. They gave her 5 years to live, and 37's been great, and she's doing amazing. But it begins with everybody picking up the phone and doing their part. So anyway, appreciate you guys letting us be a part of this. Thank you also for letting us be a part of your monthly meetings. We're in a lot of your meetings. I'm on the phone for a lot of those. So if you don't have a LifeLink representative in your monthly or quarterly or however you do it, trauma meeting, and would like for us to be a part, we'd love to do that. Just contact your liaison. If you don't know who that person is, just let me know and I can get you that name. We have had a couple of people that we've moved around, so you may have a different liaison than you did previously. Also, if you have any needs with any of your certifications, just let us know. We're here to partner you with that and make your survey a success. Stop the Bleed. I know y'all do a lot of work with that, so if we can partner with that, please let us know as well. We do have a great public affairs department. We can get people there, volunteers that love to share their story and can hopefully do some good community education as well. I've got a coworker who's a heart recipient, and he always says, if we can't help that patient get up and walk out of the hospital, maybe we can help somebody else get up and walk out. And I definitely believe that. Y'all have any questions? I do have a guest I'd like to introduce. You have any questions about LifeLink? Any needs? Again, I think on the next slide, my number is up there. Our information. Yeah. As I said, Kim is still with us. She did text me this morning. She said, tell everybody, hey, I know she loves all you guys. But anyway, I have a guest that I'd like to introduce. This is Ms. Pam Mobley, and she'll let you know why she's here as well. But thank y'all, and I'll be back here if you need anything.
Good afternoon. I am Pamela Elder Mobley. Totally prefer Pam. I feel like I'm in trouble when people call me Pamela. Okay, so totally prefer Pam. I'm also a licensed professional counselor and a nationally certified counselor. But most importantly, I'm a mom. I'm a mom that received a phone call on March 25th, 2023, from Great Memorial Hospital, letting me know that my daughter, Raven Jeffers, who was just weeks away from graduating Georgia State University, was involved in a really bad car accident. Someone came on the highway the wrong way and hit her head on. And so she was there. And so I was called to come down to see what was going on, and we were unfortunately told that she was brain dead. Most devastating news that a mother could possibly have to endure. But in that moment, I just knew that Raven would have wanted me to do something. I just felt it in my spirit. And because she was just so amazing. Like, that girl was amazing, okay? She, at 22 years old, she was only 22, again, just weeks away from graduating to Georgia State. She was the epitome of a mini-me. She was going to school to become a psychologist or psychiatrist. I was like, either one works, girl. But she would often tell me, because she loved the work that I was doing in the community and helping and supporting others, and she would often tell me, like, Mom, we're going to save the world. Like, that's what we're going to do. We're going to save the world. And so that was supposed to be our plan. But our plans changed. Our plans changed on March 25th. And instead, we had to decide to change the world in a different way. And so I made a decision to donate her organs, as many as I could, whichever way I could. Anything that we could decide, we chose to do that, because I truly felt as though that would just be the best way. Like, if my baby could not come home, I would not have want any other mom to have to experience this. And so if I could help another family not lose someone, then we wanted to make sure that we could do that. My baby wanted to do so many things in this world. She had already started her own nonprofit organization, which is AMPS, and that stands for the Alignment of the Mental, Physical, and Spiritual. She had already been doing so much work in the community, supporting homelessness, and just doing all kinds of things. And so from there, after we made this decision to donate her organs, we were kind of told about, just different ways that her organs were able to save people. I know her heart went to a teenager, and I know that just knowing that mom was able to get a phone call to save her daughter's life, even though my phone call was not. And I do not regret that decision, because there's some solace in knowing that she continues to live on, and knowing that, the staff at Grady made a decision to support that, right? They handled her with care. They loved on my baby, and I so appreciate that. And from there, we have decided to, it's 4 years now. It's 3 years since this happened. It'll be 3 years in March, but I created a Ray T. Beacon of Light AMPS Foundation, where I continue to support the community, provide grief and support in the community, and we also give out a scholarship to Georgia State students in her honor. And so this year, her birthday was September 19th, and so this year on September 19th, we'll be giving out our 4th scholarship to a Georgia State student. And so that's just how we continue to honor her and love her and continue her legacy. And yeah, so that's it. Thank you so much for this opportunity and just allowing us a space to let you guys know that what the work you do and what it looks like, even on the other side, even when you're unable to save people, sometimes the work that you do still allows those families to find different ways to save others. So thank you guys so much.
Miss Pam, you can't see, but you're getting a lot of love on the screen here. People are popping up all the hearts and all the love to you. So, and Chuck, thanks for bringing Pam along to tell that story, because a lot of times as the caregivers, like, we don't see this side of it. We see the preparation side and the calls that you had with Grady and getting her ready, but like, it's so helpful for us to hear this piece, because it's, it's hard for us too. We have to do what we do, and we don't want you to see that side of us. But thank you for giving us that feedback.
All right, next we have our report outs from Georgia Trauma Commission, starting with Liz and the GTC update.
Okay. I think most of you guys were here for the morning, so I don't want to belabor my commission report. It's in the packet, in the commission packet that can be found online, so please refer to that. But I will highlight that we're heavily into budget season now. The amended budget is moving through, and the FY27 budget has already been taken up, so it typically does go through the last day of session, which is not till April 6th. So I don't anticipate we're going to see it much sooner than that, but the extra $4 million, you'll all be happy to know, still is in there. Again, it's in there until it's not in there. We don't know when that will be, but we're just grateful we have it. So So fingers crossed for that everything stays the same and nothing changes. But as you all know, on that last day of session, they go back and forth between committee, and you just never know what's going to come back out of that, how that bill is going to be finalized. So we'll keep on top of that. And then, as I mentioned this morning, House Bill 629, which really strengthens, it formally incorporates the bleeding control kits into all the Georgia Public Schools emergency response framework. That's a huge win for us to get Stop the Bleed training mandatory, really. And you guys are all part of your RTACs, and thanks to all of our RTAC coordinators who are keeping all the cats herded and making sure that all the schools have their training. And, that's really monumental. So we're very appreciative of that. I also mentioned some really key federal items that are going on now, namely Mission Zero is being refunded. It's only $4 million. We're hoping that more money can be allocated to that as part of the Consolidated Appropriations Act for 2026. There's also trauma grants in there. There's trying to be more money allocated so that some of the grants can go towards mock development, which we know is going to be really critical in terms of preparing for surge. And then I also mentioned, I think it's really important for this group, and Morgan and I were just talking before the meeting started, but we were all at Northeast Georgia and Grady, had a heavy presence at the Eastern Association for the Surgery of Trauma meeting that Georgia hosted at Georgia World Congress Center. East is a wonderful meeting if you've never been. They're very welcoming of nurses. It's a very laid back meeting. It's not very starchy. It's it's really cool. And there's a lot of great stuff. And for those of you in the pre-hospital world, there were at least 8 papers on pre-hospital research related to trauma and stuff that can easily be replicated. And Crystal and I, our wheels are already spinning about how we can put that into motion. So if you have an idea for a concept, think about submitting it to, if not STN, TCAA for a hot shot or something like that. I think TCAA submissions are already closed since their meeting is in May. STN was a while ago, but East is another venue where it's a very sort of nurturing society. They're all about developing folks. So consider a submission for that because, again, it's a great venue. So I highly recommend it. And then the highly anticipated Level 1 and Level 2 readiness cost survey. Again, the data that we're looking at that, the costs were significantly higher now, and this will reflect the changes in the gray book. So we're really eager to see what that looks like. Some of our colleagues across the country have replicated our studies, and since we haven't done the 1s and 2s in a while, they were at least double or more what our last readiness cost survey was, and ours are going to be even higher than that. So look for that to come out soon. I did in the packet is also a list of all, and it can always be accessible on the Trauma Commission website under events, are all of our upcoming committee meetings. Everyone's welcome and encouraged to sit in, to call in on some of the meetings that, I know everybody's meeting heavy right now and it's just not possible sometimes. There's a lot of work going on in the different committees, so we welcome you to attend that. And then we can, I guess, turn over to Gina.
Yep, Ms. Gina. Thanks, Liz.
Great. Afternoon, everyone. Well, big item is we have our GQuit winter meeting tomorrow, so I'm very excited about that. Dr. Anchi has done a lot of work on data. I'm very excited for her to share tomorrow her presentation, especially her work around the level 4s. I think hopefully you'll be excited about what she has to share with that. And then the summer meeting will be coming up in August, and we will be at the beach. We'll be at Jekyll, so that will be August the 20th, and I'm excited to say that Dr. John Holcomb will be joining us as the keynote speaker for that. So that will be great if you've ever had the opportunity to hear him speak. Pre-hospital blood is his jam, that is for sure. So that will be exciting. The GQuit data download should be on your radar, thanks to those that have already done their download. I have gotten a few already coming up, and that should be your whole year of 2025 when you send it to me, and make sure you send your PRQ data entry report so I know what your numbers are to compare to what I'm getting, to make sure I'm getting all your records for that. And just a little information, you also should have gotten an email about your update for your registry for your 2026, and Kelly may have this on her radar too, for your NTDB 2026 data fields. If you've not done that update, you might want to hold off before you do your downloads. I know Colleen, she just sent an email because it will impact you'll get some error messages trying to do your last download of the year, because there's new fields that are added, and that's typically what happens. So might save you a little trouble if you haven't done that. For Arbormetrics, some exciting things there. As of yesterday, there's some new age filters that have been added to the platform that will allow to filter down, exclude the pediatric patients. We can exclude those, and then actually broaden to have, be able to broaden the pediatric fields. You can now get less than 18 instead of just that 0 to 14 to be able to do that. And then you can just look at patients that are 16 and greater, so you can take out the pediatric patients from the field. So hopefully that will make things, and you can put the admit service filter on everybody, so not just the VTE. So if you want to look how you're doing with your mortality for your trauma admits or your non-surgical admits or your orthopedic admits, you can put that filter on everywhere. What's next on our radar is to build the cohort filter for blunt multi-system. And that will help because you'll be able to pick the age filter, so you'll be able to get your elderly blunt multi-system by picking the age filter and the blunt multi-system cohort, and we're going to build a shot cohort for that. So that's next on our radar for Arbormetrics. And I think that's all I have. Happy to take any questions.
Thanks, Gina. Do we have questions? All right, Crystal with our RTAC update.
Hi. Like the other two, I gave a report in the last meeting, so I won't go through all the details of it. But a couple of things that I wanted to highlight. With the Stop the Bleed program, our applications are open right now for kit awards. So if you haven't received that flyer, please let us know. But we'd appreciate you distributing it among your regions. And really a thank you. The RTACs and the Stop the Bleed program, we delivered just under 3,800 kits last year. That's huge, and it wouldn't be possible without the support of everybody in this room and everybody that's online. Your RTAC coordinators are your cat herders, but it really takes the village, right? And what we're seeing now is we still have a number of small programs where people are going out and doing 5 and 10 and 20 students at a time, but increasingly we're having classes of 50 or 100 or 200 people that are being trained in a day. I know that that's a huge logistical lift, and I know that all of you are engaged in it. So thank you so much for your participation in that. The RTAC coordinators continue to progress. I know that as I travel around the state, I think I see most of you as I bounce around. So we appreciate your support of that. We've had a lot of really notable growth in specifically our PI and injury prevention through the coordinators, and of course education is continuing to beef up through that. So if there are needs that you have that aren't being addressed by your coordinators, we'd really like to know that. And if there's ways that we can better support your efforts, again, please let us know that. And then the last thing I'll do is kind of briefly discuss where we're at with EMS education initiatives. So we're very happy to announce we now have an education coordinator, which I appreciate more than anybody else. So Kristen Spires over here, she's been our Region 10 RTAC coordinator for more than a year now, has done a fantastic job with that, and I can't wait to see what all she does with education. And I promised I wouldn't do this, but it's also her birthday, so she will be spending every birthday moving forward at our commission meeting. So that's right. We'll all get gray together. But a lot of things that are happening, kind of moving parts with that right now. We've got our initial education grants that are up and running to support kind of that workforce development piece. That was a really important component with the changes, that piece was able to stand up quickly. I think everybody understands the workforce issues that we face in EMS and how critical that was. So we anticipate that those grants will stay open throughout the year. So far, I think it's been open for a couple of weeks now. We've had 10 applications, and we do have 3 classes that are already started. So that's a big win. Next on the horizon will be our canned courses, so your NAEMT, like PHTLS and things like that. Those will be running soon, and we've got a number of other continuing education courses to include the cadaver labs. We've got some MCI training that's going to come out of Augusta University, tactical training, other kind of categories like that. We're going to be leaning very heavily on those RTAC education committees to help us identify what's a great host location and to ensure that we have really great distribution. So another kind of message I would like everybody to circulate is that the one true source of information is going to be the Georgia Trauma Commission website. So under grants and programs, there's a drop down for EMS education. That's the spot. For all of our registration links, all of our application, at any time you can go there and kind of see what's going on. There's also going to be a calendar function on there where all of our courses that we're doing Con Ed will be listed under there, but we're also happy to post anything you want highlighted there. If you have a conference, if you have a virtual CE opportunity, any of that stuff, we can include that on our calendar. Frequently we hear, and it's a question in our needs assessment right now, is what's the best way to communicate? How do you want to know about classes? And so we hear social media a lot. And what we're not hearing right now is the mechanism that we use most frequently, which is via email. So we're trying to kind of direct everybody towards just one kind of sole source of resources for all of our programs and hope that that helps. And also if somebody has a Friday afternoon that they'd like to learn some cool trauma stuff, they can go see what's going on across the state. So we've got a new email address, education@gtc.ga.gov. That if you want to send flyers, if you want to just kind of include us on your listserv of any of those courses that you're sending out, we'd be really happy to kind of assist you in spreading the message. And I think that concludes my report, but I'm happy to take any questions.
Thanks, Crystal. Anybody have any questions?
Excellent.
No? All right. Next, we have our updates from our Office of EMS and Trauma, our OTCPE report updates from Marie.
Hello, everyone. Good afternoon. Let me bring up my slide again here. Okay. For the OTCPE and OBCPE performance reports, 35 of 36 centers have submitted their fiscal year 2026 quarter 2 report. And using the data reported in the OTCPE, the following statewide averages were calculated. The OTCPE statewide average for the trauma surgeon response rate data deliverable for calendar year 2025, I hear my echo, so I apologize for that. The calendar year 2025 is 95%, and for the fiscal year 2026 data, it is 98%, and that's for the trauma surgeon response rate. For the record closure rate, the calendar year performance rate is 96%, and the fiscal year 2026 rate is 94%. So congratulations to everyone for performing so well. Regarding the trauma registry imports, from ESO users, 9 centers still have leftover system or schema errors from the December download of the January through September data. So please check in with me before you start to send in your 2025 final download so we can be sure that your past errors were fixed before you send in the March final download. Based on the image trend NTDS algorithm criteria that's already in the system, the overall January through September 2025 data validity scores is 88%. And that is for 37,041 records from the designated trauma centers. And lastly, in the 2025 final downloads we've received so far for the January through December data, we are seeing a timeout system error. This causes the downloads to fail. So ImageTrend is aware of the issue. So far, it has affected 7 to 8 facilities There have been a few imports that came in and went smoothly, but so far I've counted 8 that have experienced this timeout system error. We are waiting for a solution to share with everybody. And as a reminder, please to log in to the ImageTrend patient registry to verify your import was successful. After you get the email from the system telling you it was completed, and there you can verify whether or not there are any system or schema errors. As a reminder, the long ID errors do need to be corrected in your ESO system. That's an easy fix. Just correct those and then you can do another download. But anything other than that, a system or schema related error is going to require more attention. So please reach out to me if you see that. I am monitoring them, but I need your help to keep all the balls, all 34 balls in the air for me. So thank you. Any questions?
Thanks, Marie. All right, next we have our OEMST updates from Stacy Smith. And while Stacy's making her way up here, we have Elizabeth who was able to join us from DPH. So after Stacy does her report out, we'll let Elizabeth go ahead and share.
Good afternoon, everybody. Same thing, I know a lot of y'all were in the meeting previous, so just to highlight some things across our centers. Again, I want to congratulate Wellstar Spalding, Atrium Floyd Polk, and Emmanuel for their Level 4 redesignations, and then Northeast Georgia for their ACS Level 1 re-verification and state redesignation. As mentioned, we have 3 new Level 4s coming on this year. We are open to consults, so you can contact me and Marie, and we can do a consult, or if you have any centers interested, give them my information and we can discuss moving forward in becoming our trauma programs. Marie covered the registry world. If you are having issues with those downloads, please reach out to her, but we are aware that there's errors, but we are doing the downloads by March 2nd, so make sure you have those for the 2025 year downloaded by March 2nd. And then same thing with the pediatric readiness. If your facility is wanting to be pediatric readiness designated to ensure that your ED is providing the excellent care for your pediatric patients, please reach out to my office, Office of EMS and Trauma. You can reach out to April. You can also reach out to Sam Sindelar, who's in charge of the pediatric program, and we can move forward with getting y'all designated. Any questions?
Thanks, Stacy. All right, we will go ahead and shift gears and go back to Elizabeth Head from DPH to tell us about the dementia initiative.
Good afternoon. Thank you so much. I am going to share my screen real quick, if that's okay. Just have a couple of slides. Really appreciate everyone's the opportunity to chat with everyone today. You should be able to see the screen now, and we'll put it in presentation mode. My name is Elizabeth Head. I'm the Deputy Director for Injury Prevention here at Georgia Department of Public Health. And I just wanted to share with the group a little bit about the dementia efforts happening here in Georgia. We have a robust aging network in public health, and I believe also trauma is an important place to continue to care for a geriatric population. Georgia Alzheimer's and Related Dementia, or GARD, you'll hear me refer to that throughout the presentation, has been a fixture in our community in our state since 2014. Our governor appointed a GARD Advisory Council back in 2013, and from that grew several things. The GARD Collaborative, which works on a voluntary basis through 6 different committees that work on workforce development, safety, advocacy, partnership and outreach, those types of topics. And we do all of that to move forward the work of dementia and a healthy brain here in our state. We tackle things like what services are needed by Georgians, The collaborative as a whole partners with us at the Department of Public Health. Because of the efforts of GUARD, we were successful in applying for and receiving a CDC BOLD grant, which stands for Building Our Largest Dementia Infrastructure. And it's really about bringing public health into the fold of dementia work and seeing it as a public health problem. And of course, the GUARD State Plan, or Georgia's Plan for Dementia and Alzheimer's Disease in our state. That is our overall guiding document, which directs all of our efforts in our state. An easy way to get involved is to be dementia friendly or become a dementia friend. Our partners at the State Unit of Aging, the Division of Aging Services, do this training. You can get it done in person, virtually. It's a very nimble hour or less training that can be done in a variety of formats, and just really helps everybody understand what it means to be dementia friendly in both our care and how it is that we approach this set of topics. We have nearly 6,000 dementia friends across the state of Georgia right now. That is professionals, members of the community, every sector that you can think of are groups that are dementia friends. And so that's a program that we like to promote for our friends at the State Unit of Aging. We have several pillars of success that have made this work be recognized nationally. That is, of course, our GUARD Collaborative, as well as the addition of dementia care specialists. So within Georgia, under this first pillar, we have 12 area agencies on aging, as many of you may know. And for each of those 12 area agencies on aging, the Georgia legislature a few years ago made an investment of having a position called dementia care specialists. Those are individuals that you can interact with. They are generally over multiple counties, and their whole goal is to be a liaison between the community and the professionals that serve those communities. So a great way to get in on and partner on different types of programs that are specific to dementia, specific to brain health, specific to our geriatric population as a whole. Another pillar of success are those dementia friends sessions that I've mentioned. We have our Department of Public Health BOLD grant, which is hoping to train public health professionals, such as everyone here in this meeting today, on what it means to provide care for and bring together systems of care around dementia and Alzheimer's disease. We also have in our state a STARS grant, which is a national grant, and it's currently looking at different data platforms, what all of our different data from our different data owners has to contribute, and then finding ways in which to not necessarily link that data, but certainly get that data in a place where you can talk about that data amongst the different data owners. And so our State Unit on Aging is looking to do that work, and of course we're supporting them over at the Department of Public Health. The other thing that we're doing with dementia right now that is a sort of easy tie-in with the work that we do in our trauma centers is the U.S. Pointer Study. U.S. Pointer Study is the first of its kind in the United States, and it's looking very specifically at what healthy behaviors impact brain health. And so this last December, they came out with a national announcement that the 2-year randomized control trial over 10 sites across the United States, their top-line analysis have statistically significant results on improving brain function to being for 2 years of better brain function based on several pillars of success around exercise, medication management, nutrition, and regular physical and cognitive improvement types of programs. So we're very excited about working with that program. We've received a grant here in Georgia that is going to allow us to create implementation study plans. And that plan, that product, if you will, is going to allow us to work specifically on getting the Pointer Study program tenants into our communities. We're emphasizing a rural community approach. And certainly the health monitoring and nutrition pieces have a huge part of what we're going to be doing for public health, and where we might hope to see some partnership opportunities with the trauma system. As I was thinking about this presentation, I wanted to make sure we pointed out the specific things that are most helpful to our trauma commission partners. And really what that is the ACS geriatric trauma care standards. So the standards you see in front of you are part of that geriatric trauma care standard. So having lower thresholds for activating the trauma team, initial assessments, prioritizing rapid reversal, early removal of backboards, liberal use of CT scans. It has great guidelines around clinical management. Interdisciplinary team involvement is really pretty critical here, given the subjective nature of different patients and their needs. The goals of the care, facilitating early and often discussions, particularly because the use of advanced directives are more prevalent in this population. And then, of course, what are the system requirements that are needed to help manage the care for these types of patients, emphasizing frailty screening and specialized techniques. One of the things that we've seen a lot of is falls. That's known to everybody in this meeting, I'm sure. TBI patients are 86% of TBI patients eventually develop dementia. And those are generally from a fall. So there's a real opportunity here when a patient comes in from a fall and has that trauma to work with them to mitigate those outcomes. So this is a great way, as we're doing the work here in Georgia around dementia, to have our respective teams come together and work on this set of topics. Again, keeping this as interdisciplinary as possible. And making sure that we're bringing together all of the right partners at the right times. So I covered that super fast. I really appreciate your patience and allowing me to get here a little bit tardy. I do apologize. I appreciate your time. Anything that you all need, I'm here and happy to help. I am dropping into the chat the ACS TQIP geriatric trauma management guidelines, which I have found to be particularly helpful, just so you have it at your fingertips. I'm sure a lot of folks are familiar with it. Happy to also provide the slides, but as always, I'm really grateful for Liz Atkins and her continued partnership with our team over at DPH.
Right back at you. We really appreciate you, and thanks we're all looking at this knowing we need to do a better job with care of geriatric patients. So really appreciate that, Liz. Thanks.
Yes, ma'am.
All right, next we have Cheryl with Trauma Foundation updates.
Good afternoon, everybody. Just wanted to bring two things to you today. Simply a couple of reminders. Next Tuesday is Trauma Awareness Day. It is our largest advocacy event every year. It is a time when we get together from all across the state to go to the state capitol and say thank you to our lawmakers for their support. In addition to saying thanks to them during our morning program, we will tell them thanks individually as we work the rope line and have them come out to chat with us for a few minutes. Registration has closed. That's simply because the room capacity is limited, and so it's already filled. However, if you would still like to be there with us, then certainly come on down and come to the Capitol, and you can work the rope line on that day. You have to figure your own breakfast out, but we would be happy to see you work the rope line alongside us. The second thing I'd like to bring to you is our annual annual gala. It's back. You will see a sheet on the table in front of you. It says save the date. The date of the next gala is May the 30th. We will be at Delta Flight Museum. Something that is different this year, you will notice, is we are no longer changing the name of the event to accommodate or to go along with the venue. We did driving change in trauma care at Porsche. That was a lot of fun. We did Tides of Change in trauma care last year at the Georgia Aquarium, also a lot of fun. Even more fun to come this year is One Georgia Gala. That is the name that we will have from this point going forward. And it's because it takes all of us working together across the state in unison as one to make sure that everyone in the state has access to the same level of care, no matter where they are, no matter their circumstance, no matter what they look like, no matter how much money they make. We all want to make sure they have access to the same level of care. One state, one standard. So please put the date on your calendar, May 30th, Delta Flight Museum. Tickets will go on sale on March the 2nd. Hope to see you there. Thanks.
Thanks, Cheryl. All right, we're going to roll into our subcommittee reports. First, we have our education subcommittee. We have Julie or Emily with us.
Hey, everybody. Thanks for having me. Exciting year that we wrapped up last year. Had a couple of big goals of achieving more TCRN, trauma-certified nurses across the state. Lots of great efforts as far as reviews being provided, both in person and virtual, and also some additional certifications. And then our big goal last year as well was to acquire the SCN modules, which are meant to be used for orientation at trauma centers. They're customizable. We've got some great feedback. Those were our two big goals last year. We will continue to have the goal of working with Emily Brown and the Georgia Trauma Foundation and the efforts towards increasing and making accessible trauma education to the rural areas of Georgia. It's one of the big efforts of our group. And then this year we'll be working with the Georgia Trauma Commission in hopes of getting a couple of funded courses, Topic and Optimal. So that's our big goal this year. As always, if you're interested in joining the group, reach out to me directly. I'll put my email in the chat. It's a great opportunity depending on irrelevant to whatever trauma center level you have. They're all represented. We've got great involvement. This is awesome. Gabby, thank you for putting this together. So this is the interest for the optimal course. We're hoping to make it a little bit easier, more accessible to people by putting it on the front end of the summer meeting. So if you're interested here, take a look. We did some great sort of discussion and background on who it would be most beneficial for the optimal course. If you're not familiar, it's targeted towards trauma center preparation for ACS verification visits. So with that in mind, this is the list that the group came up with for being the most beneficial. However, if you're interested, go ahead and scan that QR code, and we look forward to hearing more. Thanks so much.
Thanks, Julie. All right, our pediatric subcommittee report out from Kelly.
Hey, everyone. The first thing I wanted to announce is that the pediatric transfer one-page reference document is complete. We finished it and voted on it on February the 9th. So it is hot off the press and available. We'll be sending that out to anyone who's interested. It's the document that mirrors the adult transfer one-pager. So it's called Indications for Pediatric Trauma Patients Requiring Rapid Transfer to a Pediatric Trauma Center. So we're happy to announce that that is complete and approved by the commission. The second part of the project is a quick reference for assessment, stabilization, and transfer of pediatric trauma patients. that has a little bit more information on it, and we are trying to revamp it to fit the requested trifold model. So it's just going to take a little bit of revamping, but I think most of the important information is on there, and most of the TMDs who hold stake in taking care of pediatric patients have already approved the content. So I think it's just kind of a logistics of getting it into the requested trifold model. Simultaneously, we are working to revamp the pediatric imaging toolkit. So our committee has completed all of the literature review to base current recommendations on articles that aren't from 2011. We plan to have the first rendition for our PEDS meeting that is in May, and hopefully get that out by mid-year. And the EMS Safe Transport Project is, the PowerPoint is available. We've already had 3 very large EMS agencies in Region 3 reach out and ask for the PowerPoint, and they're going to be doing that education in their January and February staff meetings, so that's pretty exciting. So I think the next phase of this project is to continue to use the QR code and see if we can make any big improvements, and then we're hoping to at least get a poster in one of the big conferences, and it'll be a GCTE project, so that would be pretty exciting.
Awesome, thanks, Kelly. All right, our Process Improvement Subcommittee, Rima.
Good afternoon, everybody. We ended our year, actually in August was our last meeting. Very productive, shared some PI tools with everybody. We're working on having shared tools that people can use to be more successful with their loop closure, reviews, and just whatever they feel that they're struggling with. A lot of great ideas have been shared. We did just have another meeting last week, got a lot more tools. We want to create a central repository for those tools for everybody to have access to them. We did try doing a Teams shared space, but that didn't work out. Some facilities block getting into it, so that's a work in progress. We also had been working on time to definitive care, but we have tabled that since there's a state process going on as well with that, waiting for their lead on if we need to do anything else with that. And then at this last meeting, we discussed doing some stuff with geriatrics, since that's going to be a state focus. So that's where we are right now with our PI. If anybody has a PI project that you need us to work on, please feel free to reach out and let us know.
Thanks, Rima. And our Registry Subcommittee report from Kelly.
Make sure y'all can hear me. So we ended 2025 with all of the registry vendor demo, the summary analysis, and just for those of you that are interested, Sarah, Colleen, and I submitted to Trauma System News to do a presentation. So we will be presenting that process on how we analyzed all those vendors on Wednesday afternoon at the summit. So feel free to come listen to our presentation. In our last meeting, Dr. Ayoung-Chi gave an overview of the GQIP analysis of data that's only right now presented to TMDs and TPMs. This was not real data. This was kind of made up data, but we wanted to demonstrate to the registrars and PI, all of the people that touch the registry, just how important every little stroke, every little key that they do how it impacts at a system level. And so it was really nice to see how appreciative she was. And my point is, without data, you can't drive quality care. So I really wanted to demonstrate that to those that weren't ever at the GQuIP meeting. So she did that. It went over really well. The rest of our meeting was based off of examples or questions that people had submitted. I've gotten a lot of good feedback on that because for whatever reason, people were sending me questions over that 3 months. And so I had all of those on the agenda on the presentation, and it generated a lot of discussion. And I can say since then I've gotten 3 more questions. So I feel this will be a trend moving forward with the registry subcommittee of how do you do this? How do you handle this situation? So that's just kind of where we're headed. Another thing that has come up, like Gina said, with the downloads, there have been a couple of issues, and 2 of these came out today, hot off the press, so I'll be sending these out to the group. But one is based off the conversation about ABGs, and I think, Heather, you and Athens kind of dealt with that the most. But if for ESO users, if you have a base deficit error, there is now, ESO has a process that they want us to follow. I will be forwarding this out to our group if you're encountering errors. The other is for a 2026 data. One of our registrars tried to validate a January 2026 record in the ITDX tab and is getting an error because aspirin and warfarin were added to the dictionary. And so for VTE prophylaxis, it's saying it's not a valid menu option. So I text Colleen. Colleen, are you on? She may not be.
Yeah, I'm on. Can you hear me?
Yes, we can hear you. The VTE prophylaxis, what's your, what's the plan there?
I put in a work order and I emailed Ambra and Christina. I wasn't sure who to email at ESO. And I have not heard back. I just got a email from ESO that they received my request for support.
So stay tuned. As I get these from y'all, I'll turn around and ask you, is it okay for me to share this with the group? And then I'll forward it out to our the GCTE contact list that Marie so kindly updates and keeps up with. So when I get these things and we have resolution, I'll forward it out.
Sounds good. When I hear from them, I'll let you know what they say.
Yeah, the question that's in I see that from Linda about the 2026 updates. For those of us that are web-based, the 2026 update's already been pushed out. I'm not sure about others.
More than one, but also the flight is like $200. So just buy the flight.
Somebody unmuted
Buy it.
accidentally. Can you just check to make sure your line's mute?
And that's all I have.
Thanks, Kelly. And injury prevention, we have Crystal.
Good afternoon, everybody. We're having a great time. The first update that we have is this week we're going to try to move our meeting date. Meeting date on 25th with several meetings.
Hey, Crystal. So sorry, we're having a hard time hearing you. It sounds really muffled.
Yeah.
No.
Can you understand me at all? I'll make it a little louder. Can you hear me now?
Still pretty muffled.
Yeah. If y'all can't hear me, then I'll just forget my report and maybe send it out as an email.
Sorry, Crystal, we really can't hear you. Is Justin on? Okay, I can just share the brief update that we gave this morning to the GTC on what the Injury Prevention Subcommittee has been working on. In the month of January, they had more than 250 attendees attend the Stop the Bleed Winter Blitz, and they also held a Matter of Balance coach training in January. And then in the spring, they have several teen driving prevention events lined up, as well as child injury prevention webinars being held in April. All right, anybody have any questions? No? Okay, thank you all from the subcommittee reports. And now we have new business. Moving on to hand it over to Tracy.
We're just open to shared experiences and celebrations.
Anybody have anything to celebrate? We're here, yes, as listed. We're here, that's a celebration. Anybody have any pearls, shared experiences?
I do have just a random question for folks that are either preparing to undergo survey or if you've undergone survey lately. What has been the ACS's feedback on the geriatric requirements since Liz did that excellent presentation? I'm just wondering if folks are having issues meeting that, and has there been anything specific? Oh yeah, here we go. Okay, good. Thank you for being so brave, Jessica.
Hey, it's Jessica Mantooth at Northeast Georgia Medical Center. I'm going to look to Dr. Vassie for this, but I really felt like they did not harp on geriatric for us at all. We had a geriatric guideline that we created. We were looking through some of our ortho stuff, and honestly, it's kind of a smattering of things. I'm happy to share it, but we look at it frequently and we're like, we should probably add this. We probably need to have an algorithm in it, but I didn't feel like they harped on it at all. It was not heavily focused on.
Well, that was going to be my next question. What did they harp on?
Our OR stuff, I would say.
Like availability, schedule?
Yeah, OR availability, kind of our process. I would say when you're filling out your PRQ, make sure that you really are able to describe well what your process is. If you describe it well in the PRQ, they're not going to ask about it very much. But I think the surveyor literally looked at Vassie and I and said, so how does your OR actually work? And I was like, oh, that's good. Okay. Yep.
That's the first sign right there that something in the PRQ was lacking, right? So was it more, it wasn't like patients who, were coming immediately. Was it those access for those time-sensitive orthopedic things and stuff like that?
Yeah, it was mainly orthopedic for us, which we've struggled with in the past. Yeah.
Oh, no, you gotta come right here.
Nadira Burgess from Northside Hospital, Gwinnett. I'd say our experience in regards to geriatrics was the same. They didn't harp on that. For us, it was time response for our orthopedic and our neurosurgery consults. We struggle with getting that documented time. And so that was really the area of focus for us. But geriatrics, no, the same. Mm-hmm.
What'd you say, Ashley? Ashley was asking about their visit got pushed back, so she wanted to know response time for picking charts and stuff. Because they're telling you now what charts they're gonna, so you just want to know, like, what's the response time for them telling you which charts? It sounds like you don't have your charts picked out yet, do you? Oh, okay, so they shouldn't change it then. Okay.
I think you have to have it. Josie, where's Josie? So she's already got her charts picked, and they're surveying in April, but she's been ahead of the game. I was like, oh, wow. We submitted our list at the required deadline, which I think was 45 days ahead of your survey, and then we had a lot of oddities. We were right before the TQIP conference, and so we didn't have a secondary surveyor until like 3 weeks out. It was very stressful. So we had our chart list created, and then we submitted that, and they had them turned around within 2 or 3 days to us. But if they don't respond within 7 days, you're supposed to email that lead reviewer back to say, hey, just checking in on my charts. The other thing is they choose 25 if you're just adult. They only chose 20 for us. And the college didn't say anything about that. I don't know if I'm supposed to share that, but. Do they?
Well, now you're on public record. No, I'm just kidding you.
Leave that out of the minutes.
No, because I think they know when they read their PRQ and they see your patient list what they're going to hone in on. So they already have their plan before they ever even walk in your building. That's coming from the surveyor perspective myself as a surveyor. They know where they're going. Those are great questions. Not to hold us here any longer, but since we do have time, we never have time to talk about this. I just is curious, and I don't want to open up this can of worms, and you're happy to come chat with us after, but how's everybody feeling about your registry? Smile. Is everybody, who's still on the legacy V5? There's only only 1 or 2 centers I think have moved over to the new product, and the new product still is not able to, we're not able to receive data. So just be mindful. I know this is a weird time for the registry right now. This is a place I could honestly say I never imagined us being between products and with the new, go ahead, Kelly.
Well, no, I'm getting that question just based off the year of analysis that we did. And, this presentation, we were getting a lot of pressure of, which one? And there's not a clear answer. There's just not.
And tell people, for folks in the room who are unfamiliar of the analysis that you did, what I thought was stunning was your top score was like 100, and like the top score of what you evaluated was only like 50 or something.
50, so it was right at 57%. And a lot of it was questions that could not be answered. At the point, technology changes every day, and that's the problem. So what we did back in the summer is old news now, but some of the criteria that were there could not be evaluated because we made the decision that unless they had it where we could see it in like working, they got a 0. And so a lot of it was, it's coming. And so now maybe if you redid the demos or kind of revised or analyzed using the tool, the scores may be different. But at the time of what we did, that's where it was.
Do you think it would be useful to go ahead and redo the evaluation as I know, I'm sorry, I hate to ask you guys, but now that you have the tool perfected and everything, don't we want to know who's worked out the kinks?
Oh my goodness, really, Liz? Really?
Are people going to?
Really?
I better, my new car, don't hit my tires or anything, please. Already. I'm only asking because, of course, I'm getting a lot of questions from startup centers, and they want to know. And so I can't, as a state entity, we have to be vendor agnostic. I know the problems that you have had, and hang on one second because I want everybody to hear that. But Where we have had to, for those of you who are at the commission meeting, you saw the budget line item for Arbormetrics, which is like over 500,000 a year, right? But we're paralyzed with data without some sort of infrastructure platform and statistical analytics support in order to churn that engine, right? So if we don't get your data in a format that we can't use it, we can't, like, that's the only lever we really have. So my firm stance is that, like, you can tell me that you're sending your data all day long, but you're not compliant unless I receive all the data elements. And
and what I can tell you is that some of the lessons learned that we were going to talk about is not every center is the same, and not every need is the same, and some vendors met the requirements of centers better than others. So when you had 35 people emailing me their thoughts, it was interesting. We all got a different perspective based on level, based on role. There were pros and cons of each. And so I don't know that as a state we could say this product meets everybody's needs.
Yeah. Would you say it was more categorical based on whether you are urban high volume center versus rural or lower volume center, or was it more of a preference of how they documented and stored PI and utilized like outcomes module and that kind of thing, or?
I think it was more based on role. I will say, like your research, high level research, like that's a great example. So the historical data and bringing that forward, that's massive. That is a huge undertaking for larger centers and research-based centers, where centers that don't do that, I mean, that it is important, but it's not the end all be all that it would be for Grady or Northeast Georgia or Savannah, or so I think it's just going to be a complex problem / solution, don't you think, Sarah?
Well, and that's
so
actually
Sarah's going on the record saying she agrees with me. I'm just going to call it right out there. So
well, and actually my point was going to be a lot of the vendors are actually doing a lot with AI as well. And I think it would really behoove us to really take another look at all of these vendors to see the advance, because I think there have been a lot of advancements in the last year related to AI capabilities as well, which is going to help decrease the workload on some of our centers and to make them better, hopefully. So I really think we're going to have to either relook, and I don't know that we're going to find something that meets everybody's needs.
Yeah, and the good news is that at least they've extended the sunset date for V5. The problem is for new centers. What do we tell them to do? Because I don't want them to get into something that then they can't submit, and we're still not sure that they're even going to let new centers come in and be on legacy. So I don't know. Okay, sorry I opened that can of worms, but I get the questions all the time, and plus I want to make sure, and I'm going to make sure the administrators know so that they're not hearing it for the first time, and that you guys have some support, that just be mindful of the wording in the contract that says that the GQuip program makes the determination of whether your data has come over cleanly. It's not just, oh, we submitted the file. Because if we get something that's not usable, you're not participating in the system essentially. So.
Well, and I'll put back on the agenda for our April meeting that we'll go down this rabbit hole again and be looking for interested parties for my 35 people that did it before.
I'm going to wear a bulletproof vest. Yeah, so thank you. Ashley just mentioned, and for those of you who are on the call, which are probably a lot of new centers who aren't here in person, but you're on the call just to get what's going on. I actually have a state systems contact at ESO, so let me reach out to that person and find out, look, I can't have people come on and pay for a registry product because that's part of our program is startup grants, right? I can't pay for a product where you can't give me data. That just makes no sense, right? So, so what can we negotiate here? So thanks for bringing that up, Ashley. I will take that on happily. Yes, right. Yeah. No. Those are great things because that I can bring that up to the state person too to say that we're not, and because. Yeah. Okay, super. Thank you.
Anybody else have anything? No? All right, well, we'll give y'all back some time. Thank you, guys.
Hey, I'm sorry. Can you all hear me? This is April Moss.
April?
Yes, can you hear me?
Yes, we can hear you.
I had to hit the road, but I was listening in, and I wanted to just add on to what Liz said about making sure that the data and whatever registry choices people are using, that it goes the same way with the state. So when you're making sure that your contracts for any new registry or registry updates, not only GQuip compliant, but compliant with your state registry requirements as well.
Thanks, April. All right, everyone have a safe drive home or enjoy your hour before your next meeting.